Welcome everybody to Greeley's Healthcare Podcast. Today, this is Bud Pate, and I will be having a conversation with my good friend and colleague for over 15 years, Dr. Rick Sheff. Dr. Sheff is the Chief Medical Officer for the Greeley Company, and he's been with the Greeley Company for 21 years and counting, a long time, and is a thought leader in the field. And what Rick and I thought would be very helpful is for him to bring those years of experience to our colleagues across the country in this time of crisis. Good morning, Rick, and how are you doing?
Good morning, Bud. Great to be here with you.
Great. So, Rick, you wanted to talk about problems that don't really have a clean solution. I know that that's something that we encounter often in healthcare, that there are problems that we just somehow have to manage, that there's often no right or wrong answer. And I think during the COVID-19 crisis, that's even more apparent, that there are no good answers to these difficult problems. But I know this is an area that you've put a lot of thought into and actually been a national leader in how to manage these problems. Maybe you could talk about that a little bit to our friends on the phone or on the podcast.
Thanks very much. Happy to do that. So as I was thinking about how to be helpful in this time, and I just want to begin by saying my heart goes out to everyone who's working in hospitals, in healthcare today, on the front lines, dealing with the COVID-19 pandemic. You are our heroes. You're showing up every day. You're doing it. For those who are preparing for what is coming to their communities, thank you for that preparation. For those who are in it, up to their eyeballs and beyond, and doing just amazing things in the face of the challenges, I want to say thank you, and please stay safe. So as I thought about what would be helpful to all of you who are out there, the title that made sense was Critical Guidance to Succeed in the COVID-19 Pandemic, Managing Problems That Don't Have Solutions. Because as Bud said, that's your world right now. So let me give a brief background to this, because this approach of recognizing that some of the challenges we face are problems to solve, and some of them are not solvable but must be managed, has been part of Greeley's methodology for many years. This was an approach developed by a man named Barry Johnson, and he called it Polarity Management, how to diagnose and manage unsolvable problems. And it's been brilliant work by Barry. It's being used by many people, frankly, around the globe. And I can tell you, when we have taught this at Greeley's national seminars, I was teaching this at one of our CMO VPMA retreats. And as soon as I finished teaching Polarity Management, someone said, oh, this is great stuff. I can use it as soon as I get back to my office. And then he paused and he said, I can use this as soon as I get to a cell phone. So that is the spirit I hope you will take this with. So it's about reframing that challenges will come at us, and some of them will require problem solving that is either or thinking, either A or B. And some will require a different kind of thinking. And that is about when you can't solve it, but you have to manage it. And if you are able to make that diagnosis as these are coming at you, is this a problem to solve? Or we'll call it a polarity to manage. And we'll come back to what that means in a minute. If you do so, it will help you remain fluid and flexible, help you get unstuck as you face these challenges. So this will be applicable if you're working locally in any particular hospital, in a system. It applies to our nation as a whole, and frankly, for the whole world. And I think you will see that makes sense as we discuss this. And I will frame this by saying your success, that's you personally, your department, your hospital or group practice, your system, our nation, in fact, humanity on this planet, our success will be directly tied to how well we manage these polarities that we face, these unsolvable problems. So let's go to what we're talking about here. Let's give you an example. Every organization in the world struggles with where they want to be on a spectrum between two poles. The language for one pole we'll use is manage loose. The language for the other pole is manage tight. There's a value to each pole. Manage loose is flexible, creative, entrepreneurial, empowering. Manage tight is how we get to high reliability, standardizing to patient safety, patient satisfaction, to cost effectiveness. And healthcare as an industry has been in the midst of a journey of having been too managed loose to becoming more managed tight. That's what evidence-based medicine is: pay for performance, transparency, accountable care, the whole patient safety movement. The problem is there's such a thing as too managed tight. In the world we used to live in, we call it cookbook medicine, restraint of trade. Today, we need to apply this framework to COVID-19. I think you can understand immediately how managing this polarity is what we as a nation are struggling with, about how much social distancing to do. And we disagree in different ways and in different communities for what is the right degree of social distancing. We need leadership guiding us in that. And frankly, we've learned that we need to be very managed tight in social distancing. And those places that are not are suffering a rise in the number of COVID-19 cases. So this is a place where we need to be very managed tight in social distancing. So let's shift now from social distancing, which is a nationwide challenge, a local challenge, a community challenge, a personal challenge that each of us has in deciding how much social distancing we will participate in versus not. Recognizing we're learning more managed tight is better than managed loose in that. But let's now shift to what you're going to struggle with, which is protecting your healthcare workers. And how managed tight will you be versus how managed loose? And it's very telling that just last night there was a CNN report where they went into the emergency room of two different hospitals in Brooklyn, New York. And they showed one hospital where everyone was in Tyvek suits, in face shields, and everything was done in a, call it, managed tight way. And another hospital, not very far away, facing the exact same volume of surge of COVID-19 patients. They had people in OR gowns that were tied, but not that carefully. They had people walking around without the plastic shields on. And now that's the question you will face. How managed tight will you be in protecting healthcare workers? And now that will then run into, clearly we want to be as managed tight as we can. I'm going to come back to that in a little bit. But we are all in fear of running out of protective personal equipment. Or it's actually, I believe, personal protective equipment. It's just PPE. But this will be, now you may be forced to wrestle with how managed tight will you be if we start to run low on that. Will you allow workers to face patients without the full level of personal protective equipment? And you will have to manage that, because we don't know as a nation how bad this is going to get. We don't know in any given community what supplies will be available or not. And you who are on the front lines and providing leadership in your organizations will wrestle with, will we say, we're still going to have to take care of patients. We will be as managed tight as we can, but let's not tie ourselves in knots. We got to do the right thing here. And I'm going to come back to that in a minute. But here's an area where we might choose to be more managed loose, which is around credentialing and privileging, so that we may have, first of all, surge volume that we're going to need more warm bodies of doctors, nurse practitioners, PAs to work in these environments, and physicians who have been in an ambulatory environment or advanced practice providers may be pulled into the hospital, and we'll say, well, will we expand their privileges? And I want to direct you to, we've done a separate podcast where I interviewed Mary Hoppe, Dr. Mary Hoppe, on giving guidance on credentialing and privileging issues associated with COVID-19. So I'm not going to go into that in great detail, but we certainly are going to have to expand privileges for these providers. And the best tool, if they're already on your medical staff, is through temporary privileges. But guess what? We're not going to be able to have proof of current competence to do this new stuff. We're going to have to get somewhat more managed loose about that. But then we're going to have some degree of adequately managed tight supervision so they're not out there doing things that nobody knows what they're doing. They may be the wrong things to do. So you will wrestle with how we'll have to be more managed loose in authorizing them through temporary privileges, or for someone outside your organization coming in, disaster privileges, but then provide the appropriate degree of managed tight to the best of your capability, given the resources available in the supervision and accountability and guidance you will provide. Let's now go into a little deeper dive into another related polarity, but this one is the polarity, and that's the term we use when you have two, we're going to call them, Barry Johnson describes them as interdependent opposites. It's not either or, it's yes and. And if you have more than two poles, it's called a multarity. Well, right now there's a critical one that we are facing. And one pole is serving patients, meeting patient care needs. And the other pole is protecting healthcare workers. That's not a problem to solve. That itself is a polarity to manage. It's a more specific, it's actually not exactly the manage loose, manage tight polarity, but you can use manage loose, manage tight to frame how you will approach this challenge. But serving patients is a good, this is what we went into medicine to do. And again, back to that CNN report just last night, they were interviewing a physician who said, this is what I went into medicine to do. And then he said something very telling. He said, it might even have been a woman, I'm not sure it was a male physician, I'd have to remember who it was. We will succeed or die trying. Wow, what a statement of mission, of purpose for those who have chosen the calling of medicine or nursing or respiratory therapy. It reminds me of Doctors Without Borders, an organization that has been dedicated for decades to going into the most dangerous environments and serving patient needs there and putting their doctors at risk and their nurses at risk, but doing it with a purpose, with a mission. So we will wrestle with this. We don't want healthcare workers to die, but we know some will. Some will get exposed, some will get sick, and some will die. We can't protect all of them. We are here to serve patients, but it's important to not say either or. I'm not going to rush in there with no protective equipment because that's foolishness. So now we have to ask the question, and this is another way polarity management can help us, which is when you're dealing with a polarity to manage, where both poles are good, we ask the question, what's the higher purpose of managing this polarity well as opposed to not managing it well? And in this case, if we're managing the polarity of serving patients and protecting healthcare workers, we might say the higher purpose of managing that polarity well is the sustainability of our capacity to serve our community. The more healthcare workers get sick, the more we are not going to be able to do this. So we will have to manage this. And what we find in managing polarities, one of the insights is if you overvalue one pole to the neglect of the other pole, bad things are going to happen. There's a time and a moment when you do have to focus on one pole because it's the right thing to do, like protecting healthcare workers, but not to the expense of serving patients too much. So we will manage that. You don't solve it. A polarity is indestructible. It will be around tomorrow to manage and the next day to manage and the next. The best we can hope to do is manage it better tomorrow and we managed it yesterday. And that is exactly what you on the front lines of the COVID-19 pandemic, that's all you can hope to do, is manage these polarities better tomorrow than you managed them yesterday. And I hope this information we're sharing will help you. So there's another polarity that will come to the fore here. And this could be framed as what's called hierarchy and partnership. Hierarchy is top-down command and control in an organization. I'm your boss, I say jump, you say how high. Partnership is we're equals, we're going to collaborate in here, and we're going to figure this out together. So as a leadership team in healthcare, in your organization, you will have to, in any given moment, on any given issue, say, how much are we going to do this through hierarchy, through what we'll call an effective chain of command? Like, how are we going to allocate scarce resources? Or here's a tough one. If we do get to the moment of triaging, who's going to get a respirator and who's not? Do we want to leave that to the frontline workers? Or is that something that in a top-down way, we're going to have to provide guidance that says, here's the way we're going to do this, either with an ethics consult, or here are our priority of which types of patients get respirators over ventilators over others. Just this is very challenging to think about, but that's something where giving that guidance to the people in your organization so that people on the front line don't feel burdened with that. That's an appropriate use of hierarchy. Messaging around how managed loose and how managed tight you will be. That's an appropriate use of hierarchy. You want to give guidance to your people, to protect them, to let them know you want to protect them, but also balancing it with serving patients. How you message that and how you balance that on any given issue, that's something that you would do in a hierarchical way. But partnering, this is where people will be on the front line. These are workers. These are your anything from doctors, nurses, respiratory therapies, ward clerks, everyone down there in the front lines, pharmacists, trying to figure out how to do this together. And they're going to need to be empowered to get really creative and to create workarounds for obstacles that they encounter, to make tough calls and know that the leaders will support them as long as they do their best and act in good faith. That's a level of partnership, and delivering that message that says, we have your back. We know you're going to face things that there aren't simple solutions for. And if you got to do a workaround, please do it. We support that. That's partnering. Let's tackle another one. This one can be described as, which is more important, success of the part or success of the whole? And the answer is yes. That's the answer to all of these polarities. It's not either or, it's yes and. Now let's take an extreme example, but unfortunately we're seeing it. It's the issue of hoarding. Hoarding food, hoarding personal protective equipment, and yes, hoarding toilet paper. That's about valuing the success of the part, me and mine, over the success of the whole, which is we are in this together. We truly are in this together. But there really is the protect me and mine focus that it's not inappropriate because if I am not for myself, who will be? But here's the deeper question. If I am only for myself, who am I? It's in moments like this when we must face these challenges that we will define who we are, what our legacy will be, how we will be known to others. And there's a time and place to say we are in this together. This is about the success of the whole. I have a favorite cartoon. If we were doing this as a PowerPoint, I'd show you the cartoon, but picture a rowboat. And you've got two people in the bow, and the bow of the rowboat is really high, and they're up, and one's looking at the other, and down in the stern, you see two people frantically bailing the boat because it's got a huge leak. And one person in the bow turns to the other and says, I'm sure glad the leak's not in our end of the boat. That's not getting it, that we're in this together. We are all in this together, and we need to think about the success of the whole. So protecting our community with that social distancing, but also in your organization that everyone feel the flexibility to move to, it's not just me and mine, it's success of the whole. But if the parts don't succeed, the whole won't succeed, which is why it's not a problem to solve. So think of one person, what's in it for me and mine, that's me, versus the community, the society, the organization I'm a part of. Think of departments within a hospital or practitioners within that department, thinking, what do we have to do to make our area work well? We're going to have to balance that against what does the rest of the organization need so the other areas work well. Same thing for one hospital within a system. Is it one hospital? So some hospitals in New York City are saying we will be a COVID-only hospital, so we help the system. So we'll take that on. That means other parts of the system are going to have to pick up the slack in other areas. Let's go to another polarity. This one is manage short and manage long. We usually say, if you don't manage short, you won't be around to manage long. But if you don't manage long, meaning what's our long-term goal, our vision, what are we building towards, then you don't have a direction and you're far less likely to succeed in the long term. Right now, in the current crisis, leaders of every hospital and every healthcare system are in manage short mode, and that is appropriate. We're going to value in the current crisis, preparing for and managing through whatever surge will come. That is managed short. We want to consider what we will sacrifice regarding our capacity to succeed in managing long. But in a crisis like this, it's okay in this case to say manage short wins. But knowing that just staying in manage short is not sustainable. Overvaluing one pole to the neglect of the other for an excessively long period of time is not sustainable. So it's okay to go into manage short mode. Some people be worrying, well, how much manage long should we be doing it? Keeping them in balance and say it's not a problem to solve, it's a polarity to manage. Now let's come to one that I think makes perfect sense. It sort of sums up many of the ones we've been talking about. This is the one we'll close with. This is the polarity between safety and freedom. We want to be safe, but we can never be completely safe. We want to be free, but we can never be completely free. This is a polarity to manage, and we are living it very intensely through this COVID-19 crisis. Now, if anyone's ever raised a teenager, you know what I'm talking about. Because when my 16-year-old came to me and said, Dad, I'd like the keys to the car, I immediately thought, I need to put you in a bubble and keep you there until you're 23 to keep you safe. That's not what he wanted. He wanted his freedom. And then we wrestled through the rest of, as you do all through raising a teenager, what can I do to keep them safe versus what kind of freedom should they have? That's exactly the way to frame the challenges we are facing as a nation. What freedoms right now are we willing to sacrifice to gain greater safety? And we're making that choice as states and as a nation. We're saying, I will not go outside of my home. I will not make personal choices for recreation. I will give up even a precious right such as the freedom of assembly. I will give power over to the government to make decisions, hopefully in the best interest of all of us. But that's not a problem to solve. That's a polarity to manage. And this is in manage short mode that we are allowing this to happen. We will need to move into a manage long mode and say, what is sustainable? Because this virus is not going to disappear. We hope to have some antiviral therapy. We hope to have a vaccine, but not for some period of time, on the order of a year or more. So we will have to determine over and over again how much we are going to agree to give up our freedoms for some degree of safety. It's not 100%, it's not a guarantee, but some. And how much will we say, these are freedoms we will not give up? Or if we give them up, they are for the managed short term, and we will need to reel them back in from our government around how we will deal with our personal choices and our freedom to function and move throughout our society. Safety and freedom applies within your organization as well. How much safety can you really work to achieve for everyone in your organization, including the patients as well as those working there, versus how much freedom are you going to give them to do the right thing, to live their lives? This is a very challenging time for all of us. And I believe if you take whatever the challenges are that are coming at you and use this framework of polarity management to reframe the challenge, not either or, but yes and, how much we're going to value one pole right now because it's the right thing to do now versus the other pole. You've been managing polarities all your lives. Now it's time to use that framework to help you succeed during this time of the COVID-19 pandemic. I hope this is helpful to you. For those who want to have a dialogue about it, I will provide my email address. It is rsheff, S-H-E-F-F, @greeley.com, and we'll have a link to be able to send communication with me attached to the podcast. Once again, thank you to all of you for everything you are doing on the front lines of healthcare. You are our heroes, and please stay safe.
And thank you, Rick. This is very informative and very helpful. Please feel free to visit Greeley.com, Greeley.com, as we post additional podcasts and blog posts during the crisis and after, getting ready for the post-pandemic state as well. So we're thinking about that as well. Rick, this has been great. Thank you so much. Be safe, and thanks everybody for listening.